presentations on the COVID management exercise with our legal or health team that is here with Minister and CMO. So when we've done that, I will open the floor to the normal question period for the health issues, and when that is over, those who are here for the purpose of the health briefing would leave, and then we would go on to the subject that I'm sure that many of you want to talk to or hear about, which is the Tobago and other issues. So it's a two-part, if that's okay with you. Okay, I can report that the nods say yes. Good, so let us go straight into it and have Dr. Parasram give us our update, and we'd also have some other members of his team talk to us this morning. Dr. Parasram.
Okay, thank you, Honorable Prime Minister, Honorable Ministers, members of the media, members of the viewing and listening public, colleagues. So just the clinical update for February 2nd, 2021. In terms of 4 p.m., we have total persons tested at public and private facilities now standing at 85,680. Over the last 24 hours, we would have reported an additional 12 persons being positive for COVID-19, taking our total to date since March 12th to 7,578. Of those, in terms of recoveries, we have 7,190 persons recovered, 254 are now our active cases, and 134 deaths. A total hospital load of 31, spread amongst a few facilities. Total patients in step-down are 2. Total patients in state quarantine as of 9 a.m. this morning, 296. And total persons in home isolation. Total patients in state quarantine as of 9 a.m. this morning, 296. And total persons in home isolation, 209. With regards to the Couva Hospital facility, we have 19 persons there, 3 of those in the ICU, and at Cora, there are 11 individuals. At the Signal Hill institution at Scarborough, there's 1 person, and in total there are 2 active persons in Tobago. There has been no cases, new cases overnight. With regards to our step-down, just 2 individuals, 1 at Claxton Bay and 1 at the step-down facility in Tobago. And our quarantine facility is 296 in total, spread amongst a few facilities at the Cape Park Hotel 84, at the Cascadia Hotel 12, Chancellor Hotel 21, Tradewinds Hotel 22, Cara Suites 8, Freedom Hall UE 68, Canada Hall at UWI 3, Napa 38, and Regent Star there 40 persons. So we'll now go briefly into a short epidemiological presentation by Dr. Hines, followed by Dr. Trotman, who will give us some insight into the continued public health use in lieu of, although we are going into a vaccination phase, we need to continue using our public health guidelines as we had prescribed before. And Professor Carrington will give a short brief on the variants that we have internationally and locally. So, Dr. Hines.
Thank you, CMO, Honorable Prime Minister, Honorable Ministers, colleagues, members of the media, members of the viewing and listening public. Good morning still? Good morning. Okay, the epidemiological update is going to be brief. As we've been indicating over the many news conferences that we've had over the past few weeks, we've been seeing a fairly steady number of new cases on a daily basis. From the start of the year to now, there was a little bit of an increase around the middle of January that corresponded to some extent to what may have been happening 2 weeks before the middle of January, which would have been the sort of Christmas into New Year's time period. We said that we hoped that did not establish itself as a rising trend, and we have noted that the numbers began to come down again as we moved from mid into end of January, so that the rolling average has actually fallen to somewhere between 12 and 13 at this point on a daily basis, and we continue to monitor that trend as we engage in all the various activities that we are planning as we move forward. We do know that we are still trying to maintain the low levels of transmission by having as little gathering as possible, by having as much adherence as possible to the public health guidelines and recommendations, by continuing mask wearing in particular, and the physical distancing and the staying out of contact with each other while ill. We do see the same pattern of occurrence of just about 50-50, 53% male, 47% female overall in the numbers of new cases, but among the deaths, among the fatalities, we still note that there's 3/4 of the fatalities having been male, more than 66% of them having been over 60. This is more than 66% of the total having been over 60, and more than 80% of the people who have passed on having had pre-existing comorbid conditions, meaning that they had other illnesses before, notably hypertension, diabetes, asthma, these things that increase your risk of an adverse outcome. So as we move towards trying to protect the population, we do want to encourage these groups in particular to take every measure possible to protect yourself from contracting COVID as we move forward. So I'm going to keep that update fairly brief. I'm going to make way for Dr. Trotman.
Prime Minister, Ministers, CMO, members of the media, my fellow health colleagues, members of the listening and viewing public. I first want to start off our new year by saying Happy New Year to all and to extend congratulations to those who adhered to SDM. Sanitize, distance, mask. We are looking into a favorable period, one where we expect vaccinations. Big words of caution though. Vaccine A is not here yet. And even when it gets here, it falls on that foundation that we have built of SDM. We will have to continue to sanitize properly, distance, quick rule of thumb, stretch your arms out and make sure you have that distance of approximately 6 feet. Wear your mask properly, covering the nose and mouth and not under the chin. Sanitize, distance, and mask has to continue as we look forward to vaccination. Vaccination is not going to be overnight. As you know, some of the vaccines that we are looking into have periods of time over which they have to be given, and a particular number of people will have to be vaccinated before we could really say that we are in that relatively safe zone. So until then, we must continue to sanitize, distance, and mask. SDM. A word of caution, I know that carnival is our culture, and I know that carnival is in the undercurrent. But remember that gatherings bring people together, and when we mix alcohol, the masks come off, and we are not sticking to S, D, and M. So as we move forward, I'm encouraging the population, us all, those who were doing it before, those who would like to jump on the bandwagon now, to please sanitize, distance, and mask. Thank you.
Good morning, Prime Minister, Minister, Chief Medical Officer. Good morning to the members of the media and to the listening and viewing public. So as was indicated, I'm just going to say a few words about the different types of, the different lineages, these variants of concern that have emerged of the SARS-CoV-2 virus. So just to give you some context, when someone gets infected by the virus replicates within them. It copies itself, and then it spreads to other people. And every time the virus is copying itself, there's a chance of errors being made in the genetic material of that virus. And those errors are called mutations. And that is the mechanism by which the viruses evolve. Now, when this pandemic first started, all the first few people who got infected, the virus in them would have looked very, very similar. But over time, you get these mutations accumulating, and so the virus population, they get different lineages diverging, just like you would have like branches in a family tree. So what has happened now is that a few lineages or variants of concern have come to light. They've come to light because people have been doing all this analysis and sequencing of samples. And so the ones that they've found, some of them are of concern. You would have heard of them. They are of concern because in one case, there's evidence to suggest that the virus is more transmissible. So that is the case of the variant that was first detected in the UK called B117. That is known to replicate, to be about 50% more transmissible than the other existing strains. What that means is that it's more efficient at getting from one person to another. So what that means is that the interventions that we've had in place, we have to double down on them. So the little things you used to get away with, not wearing your mask, or, well, not a little thing, but, not wearing your mask sometimes, meeting up with somebody, those little opportunities you give the virus, it's much better at getting by them. So we have to be very vigilant, as we mentioned. The other concern, and this is more so with two of the other variants, one of them first identified in South Africa called B1351, and another one first identified in Brazil called P1. The concern with them is that they are less easily neutralized by the immune response. Okay? So the vaccines still work against all of them, but they're less efficient against those. They appear to be less efficient, at least against the South African one. We have some good data, and likely the Brazilian one. Okay? So the important thing is that we need to keep the virus population down, the amount of virus circulating down, until we get those vaccines in. We do not want a situation where we have these variants that are better at escaping immunity or better at transmission and circulating in the population. It'll just make everything more difficult. So we need to be vigilant and keep up with all our non-pharmaceutical interventions, distancing, masking, etc. So that's basically what I want to say about them. Just last thing to say is that these three variants are unlikely to be unique. There are probably other ones out there. But these ones have come to light because they appear to have slightly different characteristics. There are others that you will hear of that are identified because they share similar mutations with the three major ones. But we don't have good evidence yet that they are in fact more transmissible or escaping the immune response and stuff. So you will come across variants from California here, there, everywhere. But the hard data that we have is really for those three major variants. So thank you very much.
Thank you, Dr. Carrington. And at this stage, I'd like to ask the Minister to give us an update on the perspective, the horizon in front of us with respect to our anticipated vaccination program that ought not to be too far away.
Yes. Thank you very much, Honorable Prime Minister. Good morning to the CMO and his team, Minister Young, Minister DeLobrica, ladies and gentlemen of the media. Before I get into the vaccination drive, I always like to give the global perspective and the local perspective. Globally, there are now 104,508,452 coronavirus cases in the world globally. Deaths, unfortunately, have topped 2,265,401. But there are some good news. There are some good pieces of news. I would have indicated maybe a month ago, average daily cases were peaking at over 750,000 it's now dropping to between 500 to 600,000 cases per day. So that's some good news to go with what Dr. Trotman has been saying. And deaths, which peaked at about 8,000 per day, is now going down to around to 5,000 to 6,000. Deaths which peaked at 16 to 17,000 per day is now being driven down. So we have some good news. On October 24th, I started to track the number of countries with cases over 1 million, and I've been sharing that. On October 24th last year, it was 7 countries. Unfortunately, today, it's 20 countries with 1 million, with one country right behind them, and number 21, the Netherlands, with 985,000 cases. So it's some concerning news, but we also have some good news. Now we come to the vaccines, which is where our good news is. But as Dr. Trotman said, even with vaccines, we still have to be careful. So we expect, all things being equal, with the information coming out of PAHO and WHO, that we should receive our first tranche of between 100 to 120,000 doses of vaccines, all things being equal, by the end of February, beginning of March. That will allow us, in the first tranche, to vaccinate about 50,000 persons, bearing in mind each person has to get 2 doses, their primer dose, and then a few weeks later, their booster dose. The overall plan so far, and we are being consistent with the COVAX facility, is that we vaccinate in the first tranche our healthcare workers. We estimate in the system, which is a pretty good estimate, we have about 17,000 healthcare workers throughout the 5 RHAs, 4 in Trinidad, 1 in Tobago. But of that, we'll be focusing first on the most exposed healthcare worker. So we are not focusing in the first instance on those who work in offices, in HR, accounting, and so on. We will be focusing on our healthcare workers who are the most exposed in the front line. So those healthcare workers working in the accident emergency, on the wards, in the clinics. We have almost 100 and something healthcare centers throughout Trinidad and Tobago. So they will get first bite of that cherry. Whilst we are doing that, we will try to reach out to our NCD clients in our NCD clinics who already have appointments to come in. So we are currently collating that data for NCD clinics, and when they come to clinics, those persons will be offered the vaccination, again, absolutely free of charge. That is to make sure the whole issue of social equity is adhered to. So that's healthcare workers, NCDs. The most vulnerable, we'll be tackling those in the long stay homes. But as I said in Monday's press conference, we have to get permission to take care of the medical legal issues. Once we have done that, then we come down to a class of persons called essential workers. Who are essential workers? Those are workers that we need to keep the country running. Those will be your protective services, police under the Minister of National Security, fire, Coast Guard, Army, sanitation, teachers, and vaccinating our teachers now becomes important. As you have heard the Honorable Minister of Education say, we are starting on Monday with the partial reopening of schools. So teachers will form a part of that category called essential workers. We will take the learnings we get from that, because although we are accustomed with mass vaccination programs, we are ramping up now in terms of time. We are trying to scale this up in terms of time, because as you heard from Dr. Carrington, it is important to keep these new variants from getting a foothold, from getting a real inside into our ecosystem, to prevent it from becoming endemic, we want to vaccinate as many people in the categories outlined in the shortest period of time. The learnings that we got from that, then we go on to engage now with mass vaccination sites using doctors from the Trinidad and Tobago Medical Association. This is where we start to engage the private sector now. The new president, we have been having talks that they will man some of these sites, village outreach, and then we go to the private hospital setting. So that is, in a nutshell, the strategic plan moving forward to vaccinate as many people in the shortest space of time based on exposure, healthcare workers, vulnerability, and that is the basic plan we are adhering to for the first 100 to 120,000 doses of vaccines, which will vaccinate about 50 to 60,000 individuals in the first instance. So, Prime Minister, I thank you, and that's the update on that.
Thank you very much, Minister Dayal Singh and our health team. I would like to remind our listeners that when I was here before Christmas, I did say that we were holding steady as we go. We were going into Christmas where the potential for misbehavior could have exposed us to a greater infection level, and if those levels were so elevated, we would not do what we anticipated that we could do if the levels remain approximately at the same level that they were going into Christmas. It's now 1 month after the Christmas season, probably exactly 1 month after New Year's, thereabout. And we can safely say that while we did have some instances of uncooperative behavior, both in Tobago and Trinidad, we have escaped the worst, unlike in some areas in other neighboring territories where their report was that they did have some misbehavior and it immediately reflected itself in numbers that were unwelcome. So today we can say that we've come out of Christmas and New Year's, and the potential for partying and lack of cooperation did not result in any community spread that significantly changed our numbers. So therefore, you can hold me now to the commitment we made that we would look at bringing out some particular cohorts of our students who need to come out to their place of learning. And so you would have heard the Minister of Education saying if the situation warranted it, we would be doing certain things. So I can confirm today that those things that were said by the Minister of Health and Minister of Education about what we will do with our students, that is on. So you will hear from the Minister of Education in the coming days and weeks, but in the next few days, in fact, we've already begun to do some physical preparations, the relationship between the Ministry of Health and the Ministry of Education, that cooperative arrangement, to be able to receive some teachers and some students in Form 5, Form 6. Is that Monday?
Monday.
So Monday, 8th days. So next week, we will make that step forward. I know that if we had shown the graphs of how we had gone over the months, many people would take the position that, well, we're doing well, so we could open up more. That is not how we respond to this. The reason why we are in the position that we are in today, to be able to say that we are doing reasonably well, is because we have been doing certain things. If we stop doing those things or don't do them effectively, we will most certainly join the group of countries that did not do them or were not doing them, and you see what those results are in those places. Somebody in the team this morning said that if you are in fact a blood pressure patient and you take certain actions to treat with blood pressure, when the blood pressure comes down, that is not a reason for you to say, I will go back to eating a pound of salt or as much pigtail as I can because my blood pressure has come down. You have to keep doing what you have been doing that brought it down to get the benefit of it being down. Thankfully that this COVID situation is not chronic. We have reasons to anticipate that it will eventually be overcome by our vaccination program and our behavior changes and so on. So the point I'm making is that the data now shows that we are in a fairly good place as compared to where we could have been if things had gone pear-shaped. Last couple of days ago, I was looking at some reports, some worldwide study as to how the countries have gone. We were ranked number 28 among the countries, and we are in a category that says of countries that have done well. We're ranked number 28 in the world. It's a big world. It's a large world, same virus. It's a much better position to be in than one where we are having now to think about locking down our borders, locking down our industries, locking down our workplaces and so on. We have gone through that up front. It has been very painful, very costly, but because we've kept the faith, and the thing that we've done, which initially the science did not indicate, is something that we all should have done worldwide. You may recall early in the game, Korea and in certain parts of China and around Wuhan, where this virus apparently originated, people were wearing masks. And we all looked over there, looked at them and said, well, okay, there. But it has turned out that there is sound basis because our data, if I mention one of it's just a graph that can be constructed, but if I tell you in August we were doubling our numbers every 7 days. Now if we had continued doing that a little later in August, we were doubling it every 8 days. But by the time we started using the mask, we started to expand the period of time in which the doubling takes place. If we kept on doubling the numbers every 8 or every 18 days, we certainly now would have been in a very bad situation. But when we started to wear masks, remember we started to wear masks voluntarily at first, and then the confirmations came that mask wearing is in fact probably our best response at reducing the exposure and bringing down the instances of infection, and we then made mask wearing mandatory. That has the doubling, we doubled our numbers in a 92-day period since we started wearing the mask. So compare that with doubling it every 7 or 8 days or 18 days, as you know, might be. So doubling it in every 92 days, because we are still being infected. You get the daily reports or the weekly reports, and you see that we do get new infections, but the rate at which we are infected is much, much lower than it could have been if we were not doing certain things. And the foundation to our response is what Dr. Trotman said, the things we were doing before. And I do know that some people are dropping their guards, that we are not as sensitive to the idea of the being sanitized or staying away from people. In fact, much of the pressure that is coming on the government to ease up what we have been doing are pressures about things that involve congregation. And that is the very thing that has worked for us. We started by staying home from work, staying away from people, shutting down churches and so on. That is what worked for us. If we go back to that, because we are in a relative good position, there's only one result we're going to get. We are going to go back to where we were. So while I hear the complaints, and we are not insensitive, the taking of children out to school on Monday is a managed response of working with the virus. We kept them home for almost a year. We now realize that we are not as badly infected as could have been. We do have some element of infection in the country. There is significant risk still, but that risk remains manageable only because as a population we are largely doing what is required to be done, and it has kept us relatively in a position that we can do that. Look around, there are lots of other populations in the world where taking a positive step forward is unthinkable because they are dealing with far more infection levels and rates and deaths and so on, and also the infection of the variants, which worsen the condition. So we are going to bring those children out, and we expect that they will be educated along the way, that what they have to do at the individual level. They have to wear their masks, they have to not congregate, they have to be spaced out in the school environment, and as I said the last time I was here, they come from home to school and back home. The people who have to party is the biggest risk that we're facing, and the people who will not take the vaccine. I'm hoping that a large proportion of our population will utilize the vaccines when they become available, because if the vaccines are useful, then the more people who are vaccinated, the fewer the locations for the virus to start a new operation center. If a person is exposed to the virus and the person is not vaccinated, the virus has a very good chance of infecting that person. And if the person is infected, then their body would respond in a certain way to fight the virus off, and that person would not then build up a viral load that when that person goes around, they spread it, because it is spread from person to person. So if persons become less infected and also are unable to spread it because they didn't develop the viral load to become a spreader, to become a transmitter, then the population becomes less useful to the virus. And mathematically, as we get more of those people, we should be getting less of persons who are available to be infected. So that's what we're hoping to be somewhere by mid-year. We should be in that situation, because once we start the use of the vaccines, we are anticipating that the availability of vaccines would improve as we go into the year, because there are more suppliers who might come on board, increasing the volume that is available. I know that the health department is making all the preparations to handle as effectively as possible whatever vaccines we get as soon as we get them. I know that from the time we get them, we will start to get complaints of one kind or another. Even before we get them, you will hear how the vaccine is not working and what the bad effects are. May I remind you about what happened with the gasoline? Even before we had put the new gas on, when we shut down the refinery, even before we had put 1 gallon of gas in anybody's car in the country, you in the media were reporting, people telling you how the gas was burning out fast and it smelled so different, when in fact it was the same gas they were using. But this is Trinidad and Tobago, so we anticipate some of that. But we are in a much better position now, because the availability of the vaccines seems to be given now, and we are aiming to get some by the end of this month. So we can look forward to that with certain anticipation. And I have been in communication with certain aspects of our economy. I just want to remind you that Trinidad and Tobago is relatively open in this pandemic. There are few things, I think I said this sometime not too long ago, there are few things that are not happening in the country. One, our border is closed. I passed through the airport last night, and one has to actually see it to feel it to know it. The airport was empty. There was nobody in the airport because we have closed our border. Now that border closure was a major part of our response, and of course the airport being empty is doing major damage to our economy. And of course inconvenience to people who would have wanted to go from here to there or from there to here. But that is a response to the pandemic. We were hoping, planning that by now we would have been carefully opening up the airport and doing more. But the virus is still raging. Trinidad and Tobago, do not for 1 minute believe that because we are going along on a daily basis, doing much of the normal things or getting back to some semblance of normalcy, that we have beaten this virus. What the minister said there in terms of the numbers worldwide and regionally, internationally, this virus is still with us and is still dangerous, and we are still required to behave as we behaved when we first got infected, because we can get further infections. And instead of us being able to go out now and do more, we are being cautioned that we should be more careful because these variants are out there, and we should do all that we can that is reasonable to ensure that we don't infect ourselves by not responding. The longer we keep them out, or if we keep them out at all, it's better for us. So we have, over and above the original response, we are now being asked to ensure that we keep the barriers up so that those variants don't take over our situation. And unfortunately, some people misrepresent our circumstance, and we just have to keep telling you that we're holding the line. The Minister of National Security will be telling you along the way. I've heard it said very irresponsibly that we should let everybody come home, and the government is wicked, and that there are politicians here who are trying to jump on issues that they believe would be to the government's disadvantage. I said to you before that there are 330,000 people outside of Trinidad and Tobago who have Trinidad and Tobago passports, and on that basis they can claim to be citizens of Trinidad and Tobago and have full access. Many of them have dual citizenship, but most of those people actually live in another country. However, they have been coming home on a regular basis for all kinds of reasons, and then we end up in a pandemic. And we've said to those persons, we are managing this pandemic situation by managing who comes over the border. We've closed the border to allow us to manage it. Not that we've shut the door and said who outside stay outside, who inside stay inside. That's not so at all. We've closed the border to be able to manage it. Because even as we closed the border from the very first day, we kept the energy sector open. We have a lot of going and coming in the energy sector, our people and foreigners, and they were always coming and going over the border in a managed way. That remains so. We also managed it by doing whatever we could have to bring first and foremost those persons who were caught outside when the border was closed. Even though there was some notice, we did say to people, only travel if it is absolutely essential. And of course, what might be essential to me is not essential to you, because to some people it's essential to come home to see somebody, or for carnival, or because where they are is not as comfortable as it is here, all kinds of reasons. But because we are managing a pandemic situation, the closure of the border is to allow us to manage that flow. Now, today I will still say to our nationals, unless it is absolutely essential, do not travel. Because when you travel, you're going out there. Out there has those variants. There are countries where the variants are of major concern, and there are major levels of infection in some of the countries that we tend to want to go to. If you don't have to go for really essential reasons, please do not travel. You will help our effort, because one person, 10 people, 100 people going out there, coming back here, And introducing that virus to us, the variant, puts additional pressure on us in trying to manage the threat of the virus. So if you postpone your travel now because you deem it not to be essential, you will be actively assisting the country, because you as an individual, you are not going to expose yourself in an area of high infection, and you will remain here, and we will try to keep you as uninfected as possible. So that's the appeal I'm making today. Do not travel. There are one or two individuals who believe that this doesn't apply to them. There's one particular individual who tells me, I working outside, I have to come home, and when I come home I have to go back out to work and so on. That might be so, but we cannot fashion the response to suit that convenience of an individual. We fashioned it to keep the virus out, and we've brought people home, and a major part of our response infrastructure is the state-supervised quarantine. Last week we were in the parliament, and the opposition leader attempted to tell the population that the Minister of National Security was acting in a discriminatory manner, where he was arbitrarily and capriciously allowing foreigners to come in at his whim and fancy, and we have nationals who want to come home. Of course, if that is so, then that is wrong. And that is really a matter to be raised and to be dealt with. But that was a gross misrepresentation of the situation. From day one, we were bringing in foreigners, we were taking out locals and foreigners to keep our energy sector operational. We never closed down the energy sector. After that, we started allowing many other categories of persons to come over the closed border. People going for medical attention, people who would have gone for medical attention and now need to come home, and so on and so on. Many of those things came to me personally because they didn't stay at national security. Persons contacted the office of the Prime Minister, because what we said at the beginning, there was a 3-man cabinet subcommittee, Prime Minister, Health and National Security, who would look at this and ensure that we manage persons coming over the border. When it was pointed out that those persons who got their exemptions from national security were covered by the Geneva Convention, the Vienna Convention, and then after all, but look at it, a factory got people to come. Foreigners came to a factory in Trinidad. We were so happy when our numbers were such after the closure that we were able to encourage the manufacturing sector to open. Our manufacturing sector is open, thank God. I personally went to a number of factories to see what they were doing and to encourage them to bring their workers out while observing the protocol set by the Ministry of Health. And Trinidad and Tobago, our manufacturing sector is open. So many of those people rely on foreign interventions for mainly maintenance and establishment. When it was found out that that was the group of people to whom reference was being made, then the statement was, well, okay, I don't have anything against bringing in workers for the factory, but bring in everybody, let everybody come home. I consider that to be an irresponsible, unhelpful, and undermining statement. Yes, bring everybody home. Is it that the people of this country want us to open the border and allow any amount of persons from the 300,000 people outside to come home, and that immediately would destroy the quarantine system? Because we cannot offer quarantine to people on that scale. I said a while ago, it is our state-supervised quarantine that has kept us in this situation. The minute we abandon that, we are abandoning the fight against the virus and saying, devil take whoever. I will not take that advice. I will do what has to be done. I am confident that while every single person who was caught outside by the closed border may not have come home, either because some people don't want to come or some want to come and are yet to come over in the managed system, I am confident that managing the flow of people into our country is a responsibility of the government of Trinidad and Tobago. And we have discharged that responsibility in a way that has benefited this population. And of course, I also expected that there will be instances where the system may not have gone smoothly, but the Ministry of National Security has been working with applicants. Now we're hearing there ought not to be any situation where a person has to apply to come into their country. And of course, the most irresponsible of statements is that we have made people stateless by not allowing them to come and go as they please. Ladies and gentlemen, managing a pandemic is not inviting people to a wedding. This is a life and death situation. And for those who believe that it should be a free-for-all, so as not to allow accusations to be made about statelessness and about discrimination and outright lies, I simply want to say that the government of Trinidad and Tobago is more responsible than that. And we are in a position today, not because we have acted out of fear and favor, but because we have acted in the most reasonable and effective way. So Trinidad and Tobago is now in a position today to say to you that we are bringing some of our children out on Monday. For me, that is still an act of nervousness, because I will tell you, if as we bring these children out on Monday, if the data changes for the worst, we will not hesitate to go back to where we came from in an attempt to protect our children and our national population. But the situation warrants us going a bit forward. Our restaurants are open, but we restrict the concentrations. Our bars and rum shops are open, but we restrict and prevent congregation in the bar. Bars are not closed. What is closed is the congregation at the bar, because congregation is what the virus wants. And it is not ameliorated by any amount of saying, well, we do it long enough, we might as well ease up now. Because easing up now to allow the congregation is simply to say we are abandoning the effort at reducing or eliminating the infection levels. We just have to keep doing what works, and as the numbers become more and more favorable, we will do more and more coming out where the risk level is not increased beyond something that we believe is reasonable. So having said that, it means that we stay the course, steady as we go. And on Monday, we make that goes well. We know that we've said that in April, we will try to get some of the primary school children out. I am keeping my fingers crossed that we could do that in an environment, or we can only do that in an environment where our infection levels are low. If our infection levels increase, it matters not how long we've been doing it, or how much we interpret we want to do it. We will have to do the painful things that we have been doing before. We are seeking to take the benefit of what seems to be on the good side of our effort to fight this pandemic. I don't know that there's much more we want to say there, except that we want the law enforcement to continue to enforce the law, to encourage those persons who have not been cooperating with the national effort, persons who think that they have to party and disregard the dangers of congregation, persons who believe that they ought not to wear masks. And of course, we only have to look at our big neighbor up north and see what worked, what didn't work, what happened, what they're trying to do now to come to a situation basically where we are. There's a huge effort now in North America, both Canada and the United States. Well, England is not a case by itself. England was a country where the announcement by the leadership was that let it run to herd immunity. And you know how that went. There's a huge effort now, both in terms of cost and logistics, and I dare say politics, to try to get those countries to a situation where we are at. Let us not take our situation for granted. I know there will be those who will be saying, well, since we are at this level, it means that we can do so and so. No, it doesn't mean that at all. It means that we want to get even lower. Right? Because the perfect state is to get to a point where the virus is not able to infect or is not infecting. So the low enough level that we are to allow us to do certain things now, that is not the flow. We still want to get it lower. And it doesn't take much. It does not take much of misbehavior or mishandling for it to swing like a pendulum from where we are to a worst case scenario. It does not take much. And if you follow the regional and international news, you will see that. There were some countries where a month ago it looked as if they had beaten it, and they had the formula, it was working well. The population took a little side road, and the next thing you know, the country was in big trouble. We are not immune to that. And I want to reiterate, the biggest response in this pandemic is the personal response. You are responding at the personal level, and so far, by and large, we have responded well to the management structures that we put in place. Our health system is still working fine. Our response to those who need health care had remained and continues to be available. Unfortunately, we have not stressed out beyond service that aspect of the health care to manage those who are symptomatic and require health care. So let us continue to be responsible, be even more responsible. And parents with children going out to school, you have an additional responsibility now. You have an additional responsibility to get those children safely to school. Our teachers have that responsibility to manage them at the schoolhouse. We are giving some additional assistance in doing that. And of course, it all boils down to, we're all in this together. But each individual's action could have far-reaching consequences for the worst if we do badly. So if you have any questions to the health team, now is the time to put those questions.
Joe Brown, TV6 News. Just wondering, in terms of the vaccine in phase 1, the frontline medical workers, essential workers, and so on, if there are those who, for their own reasons, say, look, they do not want to take the vaccine, does that affect them in terms of the work that they would be doing, or how does the government handle that?
Okay. Thank you for the question, Joel. So let me say from the onset, vaccines are not mandatory by law in Trinidad and Tobago. The only mandatory vaccines is to get into school, where a child must show that they are vaccinated. If they don't do that, then they have to be homeschooled. So we are having a symposium on Sunday, together with the University of the West Indies, where Dr. Carrington will be there, to address this whole issue of encouraging, and is dedicated to healthcare workers, to encourage as many healthcare workers as possible to get vaccinated. Whilst we do admit, and we have been doing focus groups over the past month or so, that there is some degree of skepticism, I think the initial numbers are not that great, but we will be looking from Sunday, from that symposium, 1 o'clock on Sunday at the new dental building in Mount Hope, to address that same issue. But it is not compulsory, but we are going to be highly recommending and encouraging as forcefully as we can that healthcare workers should be vaccinated.
And if those who don't, is there any issue of them having, let's say, a frontline healthcare worker who says, you know, it's not mandatory, they're not taking the vaccine, are they then relocated into some?
We can't do that. We can't do that. We have looked at that, we can't. But it is going to be highly recommended.
In terms of AstraZeneca in particular, because we've seen some reporting coming out internationally.
Yes, some good reporting.
In terms of it can reduce transmission.
Correct.
You've also seen other reporting in terms of Germany, the over 65s and so on. Is the government satisfied with the different types of reporting that this and also the statement from the power representative that this is the best vaccine for Trinidad.
So the CMO will address that.
Well, as the recent report, what it says is a single dose of AstraZeneca vaccine as the first dose could cut transmission by up to 67%. And it can also give you protection as well of up to 76% with one single dose. Well, that's the first dose, giving that up to 90 days from 3 weeks from the onset of the vaccination. It takes some time before you get antibody response, and going at least until 90 days in the first instance. And then, of course, you have a second dose thereafter, probably take it up a little bit higher. So in terms of the vaccine, what we got from COVAX in the first tranche is the AstraZeneca vaccine. There are other vaccines that will be part of the COVAX facility later on. You know, Pfizer is one of them that has signed up with the COVAX facility. So as you know, in total, we are expecting 33% of the population in terms of vaccines from the COVAX facility. The first one we got is the AstraZeneca vaccine, but having said that, anything that is ultimately given to member states has to be approved by WHO for emergency use authorization. Once that is done, they look at the safety and efficacy, and we are confident that any vaccine that is given to a member state through the COVAX facility will be both safe and effective. And we will not use in Trinidad and Tobago something that has not been authorized by EUA. To that end, I think they have an emergency meeting in about a week's time to determine whether AstraZeneca will get that approval, and then we will, of course, know before we get our vaccines if it has been approved or not. But we will not go ahead without WHO approval.
Prime Minister, just before we take the next question, I just want to support you on your concern about schools. With schools opening on Monday, you're going to have roughly 51,000 children going out to school. Each year in a school year is about 17,000. I want the population to understand the level of risk we are taking on. That does not include teachers, public transport. So, Prime Minister, if you'll allow me, I would like Dr. Trotman to come and say what children should do and parents should do when they reach home to make sure that children who touch hard surfaces during the day don't take the virus home to the elderly and so on, because this is nervous times for us. So, Dr. Trotman, just tell us about the public health measures from school to home.
Certainly. I really want to underscore the point that we have to continue for children as they come out to sanitize. I know it's a difficult population because fortunately for us, it's Form 4s and Form 5s. They're a little bit older, but they still need to maintain the sanitize, distance, and to wear their mask. They will be encouraged in schools in terms of their layout, and they need to also, even when they are at school, to understand that they can't hug and play the way they used to. Life is different. Extremely important, if your child is sick, do not send them to school. That's for adults too. But even more so with this volume of children that are coming out, you are at home with your child, and you should have a clear idea if your child is sick. If you see those indicators, do not send your child to school. When you come home, your child should, before entering the house, on entry into the house, be sanitizing, removing. There should be a little box there. You take off your mask, you take off your shoes, and you start that sanitizing process right there. Let them have a shower, if possible, when they come home. These are simple measures. They're effective. We've seen it work. Look at our country. Since August 31st, since we have the mandatory masks, look at the direction Prime Minister has emphasized. We have gone in, that have allowed us to today say, children, you can come out. But we're not saying children, you can come out and that's it. Sanitize, distance, mask, stay at home if you are ill. Encourage your child that they are anxious and happy to see their peers, but they cannot interact the way they used to closely together. That's the way the virus jumps around and moves around.
PM, sorry to hijack your press conference, but Dr. Trotman, when the child reaches home, should they be discouraged? Should they be encouraged to take off their clothes immediately,
Yes.
not to hug their brothers and sisters until they have showered
Absolutely.
their grandparents and so on?
Absolutely. So, taking off from what Minister Yansing is saying, not only just taking off your clothes, as I have mentioned, but also to have that shower and not to have that usual interaction with the members of the family. Because you are now, the child has now become a potential super spreader. Yes, because they are going out into the environment. So that same types of interaction at school and at home that you usually would have, you can't have, right? I do it even for my own family, right? When I get home, we take off. Similarly, even more so for the children. Thank you.
Sorry, just wanted to follow up on something. You did mention earlier the issue of vaccination of school children.
Yeah, so none of the vaccines that have been approved for emergency use or by WHO have been trialed on children under the age of 18. So we will not be vaccinating anyone under 18, which immediately takes off about 400,000 persons. So we're looking at the other 1 million to go forward. Okay? Thanks.
Thank you, Doctor, and thank you, Minister. I just want to touch on the vaccination situation. I know I've seen some concerns being raised that we get a small number of vaccines from COVAX and it will only vaccinate a small number of people. I want the population to take this in the context that we are in a long line of countries in the world reaching out for what in effect is a small amount of vaccines at this time. And that is why initially we are going to get what is in effect a small volume, and we are going to dedicate that small volume to particular people, those in the front line. Then I saw it being said, well, okay, what are we doing about the rest of the population who will not get vaccines from that? And even if we did get the full quota from that arrangement, what is the government doing to get additional vaccines? The answer is that we are doing a lot to be able to get additional vaccines from outside of the COVAX situation. To do that, we are, the African Medical Council, they have access to a large volume, 1.5 billion, acting as a group, 1.5 million. Right. They have, as a large body, access to a large volume of the same vaccines from the same source. And in our diplomatic arrangement at CARICOM with the African Medical Council, we have discussed and have accepted an offer from the Council to get some of what they are going to be having. But to do that, we as a country, at the individual country level here in CARICOM, have to commit to a volume that we will have to pay for. So outside of the COVAX group, we are now entering a group with the African Medical Council and the CARICOM countries that agree to access what they're offering us. So that's another source. And they're offering us 226,000. That's another 100,000 people. And hopefully, as we get that, and we go forward into the weeks and months, we expect that an improved availability in the marketplace will come. Because our third source is to talk directly to the suppliers who are now supplying, who are supplying the COVAX, who are supplying the African Medical Council. They also have a window for us to bilaterally talk to them and buy from them. Meaning, over and above any arrangement in the COVAX, or with the African Medical Council group, we can talk to AstraZeneca and buy what is available from them at prices that we will negotiate. So there are other sources of vaccines. So in the months ahead, we are expecting to get vaccines from, let us say, 3 sources. And if, as other suppliers come on the market approved by WHO, we will look there. And all of this would be taking us up to vaccinating a population level up towards the level that we think we want to get of approximately 80%. But it will not be done in one tranche. it will be done in a series of tranches, and the vaccine coming from possibly different sources. So that's what the months ahead look like. So don't be too discouraged by the small volume that our program will start with. And don't for 1 minute believe that we are sitting on our hands accepting that and saying that is it. No, we are actively involved in other sourcing efforts. And the Prime Minister of Barbados and I, we talk on a regular basis. And you know, I'm chairing the CARICOM effort at this point in time. And she is the person who is charged with some element of responsibility of managing this contact with the AMC and getting us to make our commitments. As I speak to you now, Trinidad and Tobago, Antigua, Barbados, and I think Guyana and Jamaica. So our countries have largely made our orders in. We have some orders in. And we will go with those and access what we can get of the Astrogenic Pfizer vaccine from the African Medical Council allocation. So we are working on that. It involves a lot of communication and some payments. So we are on that vein as well.
Guardian Media. I just want to ask you some questions before I get on to the health officials about the vaccine. But Prime Minister, you said that now is a tricky time, and it is a bit some nervousness going into reopening of schools, right? But if we look back to last year when we attempted to reopen schools for SEA, right, which began on July 20th, we were arguably in a better place COVID-19 wise than we are now. We were still as sporadic back then. So what is it that gave you that confidence to say, let's take the chance now to reopen schools?
So yeah, I believe in the end of July we were not in sporadic, we were in cluster. And the difference is we would not have had mandatory masking as well. We were in the early phase of the trajectory. There was something else in the mix. There was a national election as well in the mix in terms of gathering of people. So there are a number of things that were in the mix. The way the children were congregating at the time in SCA was a full class of students. There was no masking in the class. What we anticipate with these children, 4, 5, 6, that they will come out and do their SBA, and they will come out and do their labs. And they will do so in smaller groups, managed throughout the process, so they may not be there for the entire day, and they will be masked throughout their interactions. So we expect that the outcome will be better. But of course it will be looked at very closely to ensure that all protocols are being followed. And as Dr. Trotman said, the most important thing is that the children stay home if they are ill. Teachers should stay home if they are ill as well. And we don't let the virus come into that environment. And of course, if we pick it up, we get that out, and we isolate who we need to isolate as quickly as we can. So I think fundamentally there's a difference. Being the masking, having the older children will make a tremendous difference in the way, and of course the guidelines and having smaller groups together in a larger space.
Okay, on the vaccine, Minister. So how do you foresee that reports coming out of the Oxford University about the AstraZeneca vaccine now offering some protection against transmitting the virus? How do you anticipate that would change the dynamics of how we fight COVID locally?
I think we'll have a very positive difference, but I will let the CMO go into the
so when you look at a
details.
vaccine, you're looking primarily at a few things. One, the main thing when you take a vaccine is you expect to get an antibody response so that you prevent severe disease or you prevent disease at all. A wanted, some sort of wanted benefit, additional benefit, is actually being able to reduce transmissibility, which we're seeing with the AstraZeneca in the early studies. So it is a very good benefit, and it will go well towards decreasing transmission in the country if it is maintained for a long period of time. So far we know 90 days, yes, but I mean, when you get the second dose and we follow that on, then we know how long that immunity is going to last, how long it will decrease transmissibility, and all of those factors will factor into transmission at a population level. With the Pfizer vaccine, I know they have commissioned a study, including Argentina, to actually look at the transmissibility for Pfizer as well, which will start soon, and that will, in a few months, I think we will get some data out of the Pfizer as well.
Okay, and do you anticipate that this added benefit would help in the uptick of the vaccine and would encourage the population to be more willing to have the vaccination done?
Well, I think the population generally should be encouraged by the data to have it, especially more so the data of the protective effect, the 76%, because there has been some contentious issues in the population about the efficacy of the vaccine. But I think this cements once and for all that the vaccine is safe and effective and is something that we can look forward to in the coming weeks to months for the population.
Is it possible to put a question to Dr. Carrington?
Sure.
Yeah. Good morning, Dr. Carrington.
Good morning.
So I just want some details on your genetic monitoring of COVID-19 in the country, right? Is it within your work that you're doing, are you also monitoring to see if we have any variants that may be occurring naturally within our population?
Well, the analysis that we do, what we do is called whole genome sequencing. So what we do is we actually look at all the little, all the components that make up the genetic material of the virus. So when we've done that, we have enough information to ask a lot of questions. And among those questions is whether there are mutations arising in Trinidad that should be of concern. So we're not just looking to see if we have B117, the one from the UK, the one from South Africa. If anything else turns up, we should be able to detect it. Okay?
Is anything showing any sort of signs that that could be possibly happening or no?
No, we have not. No, we've started this type of analysis recently. We are getting samples from the Ministry of Health labs and stuff, and as we go along, when we have enough data, we'll be able to make more general statements. At the moment, we've only had that one UK variant that we detected in a quarantined individual, but nothing else since. We've looked at about 105 Trinidadian samples already. Okay?
So, Lala, TVT News, Minister and CMO, I know you talked about the efficacy of the vaccine. Noting the Oxford study that a delayed second dose would increase the efficacy. Do we have the capacity to, knowing that that's 3 months in advance, do we have the capacity for storage if we get a second chance or third chance of vaccines?
Sure, I will deal with the storage issue and the CMO will deal with the technical issue. Right now, without the new facility at Couva being built, we have the capacity to store in both islands 390,000 doses at 2 to 8 degrees, which is where the AstraZeneca vaccine needs to be stored. Those facilities are distributed between Nibdec C40, the new Arima Hospital, which was built with a chiller, the new Point Fortin Hospital, which was built with a chiller. Unfortunately, the Couva Hospital was not built with a chiller. So we are now, we have gone out for tender, a letter of award has been issued, and that chiller will be constructed at Couva. Tobago already has 2 to 8 capacity. We took a decision 3 weeks ago, even before we knew you were getting vaccines, to ship across to Tobago one sub-zero freezer at -70 in case we got Pfizer, and one freezer at -20 in case we got Moderna. That is already in Tobago. So between Trinidad and Tobago, we could store right now a few 100,000 of all 3 vaccines if we needed to, whilst we build out the chiller at Couva. So capacity, we are good. CMO will deal with the technical side.
In terms of the technical advisory group, WHO's group, they look at the vaccine for safety and efficacy, yes, but they also look at conditions of use. So you would have noted a couple of press conferences ago, I would have read out the Pfizer WHO elements, which said you can't use in pregnancy, you can't use under 18, etc. Similarly, for AstraZeneca, you will get that sort of comprehensive report that will also include your dosing regime and how far apart your dosage should be to get the best effect. Now, taking the new research into consideration is important, and it's something that our national TAG group will look at as well. But again, we have to wait until WHO first approves it, and then we can look at whether we vary the manufacturer's specification or whether the manufacturer themselves will vary the specifications of how we should dose individuals with this new research that's come to light.
Is there a timeline that we're working with to have enough people vaccinated within the population? I know it's dependent on a lot of different factors such as supplies and whatever. So is the ministry working with a timeline, or it's a case of we'll wait, let's see how our supplies are going and still work towards that goal?
It's a bit of both. The COVAX facility is predicated on vaccinating 20% of the global population by the end of 2021 to end this acute phase. So that's the kind of timeline we are working with. However, when that objective was set last year, it may have been predicated on getting vaccines from January. Now we are getting vaccines from, let's say, March. So the timeline we are trying to work with is between a year and a half. But as you rightly said, Prashad, it depends on supply, which is kind of out of our control to a certain extent. But we are working hard, as the Honorable Prime Minister said, in 3 avenues to purchase and source safe and effective vaccines.
And how are the bilateral talks to get vaccines going so far? Does it seem like we'll be fruitful anytime soon?
I am encouraged that in the near future we should get some via the bilateral talks. I am encouraged.
Just a small thing about school hours on Monday, because hitherto we've heard of staggered hours, kids coming in just to do the SPAs and the labs. But I just got something from a daughter's school here saying children have to report at 8:30. It's one of the biggest secondary schools in Trinidad. Students are not allowed to leave before dismissal at 2:30 p.m. without being accompanied by and authorized in writing by a parent. So to me, this sounds like the schools are looking at, like, for their management situation of a full day of school that's a little different to the staggered hours. Can we get this, like, clarified before Monday?
Sure. So I think the best agency to clarify that, Sean, will be the Ministry of Education. And I think you should pose that question to the Ministry of Education. As to the operationalization. Okay, thank you.
Just wondering, for those who are very much into carnival, whom have been advocating for some type of carnival, would the rollout of the vaccine or threshold number of persons vaccinated have any impact on such a decision later on in the year or not?
With respect to carnival, I have said very early what the situation is with respect to carnival. Nothing has happened to cause the government to change that position. I know that there are individual appreciations and individual receipts of it, but let's face it, as long as the problem we're facing is a problem rooted and fertilized by congregation and closeness of people, that's an oil and water situation. Carnival and COVID don't mix. And as far as I'm aware, a carnival as we know it is a coming together in the closest of ways with the greatest of interaction. I don't know of another kind of carnival. I've seen all kinds of suggestions being made about things to do. There might be good things to do, but whether that is carnival, the carnival as we know it, which involves the coming together of, I think the estimate that we normally work with is 1/3 of the population. Our carnival is a carnival where about 1/3 of the population come together over a season, not even a day. It's a season. And normally by now the whole country, and notwithstanding how the loss of that has serious economic consequences and individual hardships, the alternative is something that we have to steer clear of. Let us not forget that as we miss carnival, what we don't want to be a participant in is a carnival of coffins. Okay? And the government's position is that we are going to have to miss carnival in 2021, and I hope that we're planning for 2022, because hopefully by then, things. Okay?
Any of the virtual events where they may have some people or they try to distance?
I don't want the virtual events, as long as they're not breaking the law, people are free to do what they think they want to do, but just remember that it is not the carnival that we been accustomed to. I've seen all kinds of creative suggestions, but what I even saw somebody saying we could have single file carnival, where we can have bands and mass and we could march in single file. Well, I must say that I don't know that Trinidadians and Tobagonians could have a single file. But lots of suggestions being made, and some of it might come to pass and be quite useful while not breaching the protocols. But we certainly will want to insist on the observance of the protocols and observance of the law.
Prime Minister, so you said that we will be monitoring the reopening of schools for any sort of...
very closely.
Very closely, okay. So what window are we looking at? Is it a 2-week period? You'll give it a month, what?
No. It's on a daily basis. I mean, we'll be monitoring it very closely on a daily basis. Because remember, what we are doing here, we are doing it with our eyes open, knowing that we are managing a risk. When you get into your car and driving to San Fernando or to Diego Martin, you are taking a risk, but you are deciding that the risk is such that I could go out there and feel relatively safe, that I could drive to Diego Martin and come back. And it's the same thing going out to sea. You go out to sea and you can drown, depending on your vessel. But then, depending on what vessel you're going on, you can be fairly confident that the conditions of the vessel, the conditions of the sea, the conditions of your ability to use a life jacket, all those things say, well, I can go to sea and feel reasonably safe that the risk is manageable. And that is what we're doing here. And if the situation changes where the risk increases, then we have to take a decision. Do we expose ourselves to that risk? That increased level of risk. Because once we bring out these thousands of people to interact with other people, you have to understand that there are greater risks involved, but it appears as though the risk is manageable and it's a reasonable risk to take. Because there are alternatives. If we don't do that, just think, if we can do it safely, as we did with the SCA exams, if we don't bring these children out to do these exams, what then is the alternative? How does the school year progress? What does that mean for them and their exams later down in the year? So we're trying to live with the virus, do some of the things that we would normally have done, not lose the time, but by the same token, we are trying to minimize the risk that we're facing while we try to get these things done. As my understanding is that the SCA went relatively smoothly and we got it done. Because if we didn't do that, the question would have arisen. What system would we use to advance children into the secondary school system? And so we just have to keep managing the situation.
If for any reason, if someone, let's say the first phase of the rollout of the vaccine experiences side effects or anything worse, where does the liability lie in terms of the supplier or the state, or how is that being worked out?
That is being worked out now. The CARICOM-wide initiative led by the Attorney General. What is the plural of Attorney General? Attorneys Generals? By the different attorneys, Attorneys Generals of the CARICOM region, and AG Faris Al-Rawi is leading that charge.
Okay, thank you very much for your attention to the medical side of things today, and Dr. Parasam would take his team. Thank you, Doc. And I would I would comment on the Tobago situation and take a few questions on that, and because we've been here for a little while. Okay, as you know, we have had an election in Tobago. The Tobago House of Assembly has by law 12 seats. This is a little different to the seats in the Parliament, and I think local government, where in the case of the Parliament, every so often under law, the Election and Boundaries Commission is required to put a report to the Parliament, whether an election is due or not. The Election and Boundaries Commission keeps looking at the population numbers, movement of population, and they're required to put a report to the Parliament. Once the Parliament accepts that report, that acceptance by the Parliament is an instruction to the EBC to do certain things. In that report about the Parliament, the EBC can make recommendations to the Parliament about numbers of seats and boundaries and so on, especially numbers of seats. And you would have seen that happen before. And once the Parliament. But in the Tobago House of Assembly Act, which is a very specific act to a specific place, it's a unique act in the suite of laws in the country. The Tobago House of Assembly Act is a law involving these things about elections and seats and so on, applying only to the Tobago House of Assembly. But in that law, the number of seats is prescribed. There are 12 seats in the Tobago House of Assembly. So on election day, the parties and individuals, they're competing for 12 seats. And there was always the possibility that the outcome of the election could be 12-6-6. Or even if it is an odd number, there could have been an independent who would have won a seat. And based on the behavior of the dependent and the others, you could have had a deadlock. Long and short is, in 2021, we have the outcome of the elections, the results have been declared, parties have accepted the results, and the 12 people, one in each seat, have been sworn in by the president. Those people are now required by the law in the THA Act. Only those people can now come together and elect a presiding officer. I guess the law felt that those people would have been able to do that with no problem, or that we never would have had a 6-6 situation. But the law says that those 12 people are the legal authority to elect a presiding officer. And after electing a presiding officer, the law spells out what happens after that with respect to electing a chief secretary, a deputy chief secretary, and so on. As soon as I saw the result, as I told you earlier on, as soon as I saw the result, my first reaction was to seek legal advice as to what this means if the 12 people in the assembly are unable to elect a presiding officer. I've been having that suite of legal advice so far, and I've been watching what has happened in Tobago, what is happening in Tobago. It could have been that they could have found a way to coexist, to coalition, to do whatever. But so far, that has not happened, and it is my view that that is not likely to happen. The outcome of that is that we do have in the country now a functioning parliament, we have a functioning government, a functioning cabinet, but we do not have a functioning Tobago House of Assembly in the way it ought to function with representation. It is functioning only with a continuation of the executive, because the law, as it is with the parliamentary seats, the law that is in place says that once the assembly is dissolved, as it has been dissolved last year to bring about the election, once you have not reconstituted the assembly, those who were in office remain in office, the executive council, the persons who had posts at the level of secretaries, deputy chief secretary, and secretaries. The law said they stay in place until a new council a presiding officer is selected and a new council is put in place. That is to ensure that the business of Tobago continues to be managed. Now, I've seen it said in Tobago that those persons who have found themselves caught by that law, saying that you remain in office until somebody is sworn in to replace you in the position of chief secretary and council, that this is some grab for power. That is not so at all, and it is not unusual. You look at the American situation. The American election was last November. The president lost the election. But under their law, very much like the THA Act, the defeated president is not replaced until January 20th. So provision was made for, and this is not about that no horse trading is required, no coalition is required. It's a straight case of you have an election in November, you have a period of transition, and the new president comes in January. Right? In Tobago, the law says those who are in office remain in office until a new council is constituted. In the absence of that constitution of the president of the new council, well, of course, you see what's been happening. We've seen them come together, not once, not twice, and I expect that this will go on for a while. And of course, there have been requests, and I did say earlier on that if it turns out that the solution lies with the government and the parliament, the government will act. I have had legal advice as to what the government can do, what the parliament can do, and I'm satisfied that the situation in Tobago ought not to be allowed to fester for too long. The longer we take to do this, is the longer the current situation will remain in place, meaning the longer we find the solution and activate the solution that we think is the real solution that will act, it is the longer this skeletal assembly of the executive remaining in place and Tobago being run in that way. And just to mention, in this kind of season, you get a lot of statements being made that are not grounded in fact and might be quite self-serving, sometimes quite damaging. It is being said that with this aspect of the law coming into play, that the executive in Tobago can do what they want and nobody can be held accountable. That is just so much hooey. Anybody, anytime, acting for the government, especially with government money, and does anything that is illegal, you're going to face the law. That's always in place. Has nothing to do with elections. With respect to accounting for what you've done in governmental action, the Auditor General Department remains in force for every day of the year. Has nothing to do with election and who's in office or who's not there. What is not available is the operations of the parliamentary arm of the assembly, where representatives are able to interact and question and so on. That is not available because the assembly cannot function if it is not properly constituted. Because in that THA Act, you have this situation where while you have elected 12 people, that is only a part of the assembly. Unlike in the parliament, where when you elect the 41 people, or the 26 as the case might have been, when you elect the 41 people, that process now initiates actions of the parliament and the cabinet and so on. In the Tobago House of Assembly Act, you have to go on to elect the leader in the house. There's no electing of a leader in the parliament in Trinidad and Tobago. That is done by the president, who in his or her opinion selects the person who controls the majority. But in the THA Act, you have to elect the leader in the house. And having elected the leader and the deputy leader, you now determine who is majority and who is minority. To do that, having done that, you have now to go on to elect 4 councillors, 3 by the majority, 1 by the minority, advising the presiding officer to appoint these people. And only then is the assembly properly constituted. So we are a long way from that and can't get past first post. I'm satisfied that an intervention is required, and I'm prepared to make that intervention. I've been in constant communication with senior counsels and the Attorney General in this matter, and I'm at the position now where I spoke to the Attorney General before coming to this meeting. I'm advised that a draft amendment could be before the Cabinet in a matter of days. The Cabinet will look at that amendment. There will be 2 amendments. One is an amendment to break the deadlock, give an authority so that in the instance of a deadlock, as exists now, how that deadlock can be broken. Put that authority in somebody's hand to break that deadlock. it may be the residual chief secretary, who can only call an election if the 4-year term has expired or if a resolution is passed in the assembly so to do. And with no assembly functioning, there can be no resolution. And of course, there's no 4-year term to contemplate at this point in time. So the amendment is going to treat with that. Who will have the authority in a deadlock to call an election? Now, if you call an election just like that, with that being the only rectification, then you can go to the polls and come back with 6-6. And then all of us will want a good spanking, because you don't want to do that. So there's going to be an amendment to change the number of seats. Thankfully, that issue had already been dealt with in Tobago. Thankfully. There has been a series of consultations in Tobago. Those consultations resulted in draft bills being drawn up. Those bills have ended up in the Parliament, and they are in and being actively worked upon by a joint select committee of the Parliament. In there, there's a recommendation that the number of seats in Tobago should be 15. The Cabinet will consider that, since we, by common sense, are required to adjust the number from an even number to an odd number. We will consider that, and of course, we'll take it to the Parliament where it will be debated. And once the Parliament agrees to put into force such amendments, then that will now authorize the Election and Boundaries Commission to treat with Tobago in a seat arrangement which is different to what it is now. That will be the authority for the EBC to put Tobago, whether it is 13 or 15 or 19 or whatever seats. That is what the EBC will be authorized, and only then will the EBC act on anything other than 12 seats. For the EBC to act, they will have to do their work in the field in Tobago and put a report to the Parliament, the same way they do with local government, the same way they do with general election. Now that there is going to be, on the passage of the amendment as I just suggested, once that comes into force by enactment, the EBC will now have to put to the Parliament a report saying what number of seats, where these seats are, how many electors in each seat, and so that's what the report normally is. And once the Parliament accepts that report, then now an election can be called in Tobago, and we expect that the amendments that we are making, such an election would most likely not end up in a deadlock. Because as I said, even if you have an odd number, it does not prevent a deadlock from taking place. It makes it very difficult or very unlikely. But if an independent wins a seat where there's an odd number, then you end up with a possible deadlock if the independent make demands that neither side can accept. Okay? But if we put a provision as to how to treat with a deadlock in the Assembly, whenever it occurs, then we ought never to get back into this situation. So that is what we are looking at. And the question that arises is how long this will take. I have heard it said from the voices of the majority in Tobago that they do not wish to have this be too long, and I presume that would be the position of others, and at the level of the government of Trinidad and Tobago, because don't forget that the government of Trinidad and Tobago is the government of Tobago, because this country is still Trinidad and Tobago. So we'll want to do this as quickly as possible. First step would have now to be that the Attorney General will have to produce to the Cabinet the proposals for the amendment. The Cabinet will sign off on it, and then it will make its way through the Parliament in the normal way, making haste to ensure that we don't drag it out. When it gets to the Parliament, it's going to be debated, and once it passes both houses of Parliament, it will then be an instruction to the EBC. How long the EBC will take, from information that we have with respect to what we know, the EBC was out in Tobago not too long ago doing preparations for the 12-seat election. So it shouldn't be an extended period, but by law, you have to give them a time to produce that report. As of now, I can't speak for the EBC. However, in communication with the EBC at a later stage, they might be able to indicate to the, how long it will take approximately for them. However, in any case, we get to the Parliament, the amendment is made, the EBC does that work, puts a report in the Parliament. If Parliament accepts that report, that is the first time we know exactly when the election can be called. So that's where we're at the moment. And I just don't, I think, just to say to the people of Tobago, it's a temporary situation. This is temporary. And there's no malice involved. It's just the law taking its course. This absence of an authority to break a deadlock, one can say it was unforeseen, one can say it was not very visionary. That does not change the price of cocoa. The current law does not permit some of the things that some people are saying. You would have heard it said that once the presiding officer brought the people together and they did not succeed in selecting a presiding officer, that there's no authority to instruct the clerk to recall such people. That's an interesting point of law, right? And you may recall when we had the deadlock in the Parliament in the 1818, how that happened, how that operated. I was a part of that. As a matter of fact, I was in that cabinet, and we met in the Parliament once. I seem to recall there was no everyday meeting, because once there was the issue of who is going to instruct that the Parliament convene and so on. We couldn't elect a speaker. But in the meantime, the President had appointed a Prime Minister, and the Prime Minister had appointed a cabinet, because the law was flowing there, taking its course. And of course, while that government was functioning, the parties were meeting, because I used to meet with Opposition Leader Pandey and former Minister Gerald Yetming. We used to meet separate and apart from the government going on. We used to meet to see whether in fact there was something that we could have done to have what they were calling power sharing. We had those discussions. It never resulted in any agreement to have any power sharing, and we ended up at the polls, and the rest is history. So all I could say is that ask the Tobagonians to be patient for a few weeks, and this thing will sort itself out. Under law, we, no matter how we want to do otherwise, we can't act outside of the law without being successfully challenged. So whatever we're doing here, we'll have to withstand any challenge that may come our way, and of course it is supposed to be a solution to an existing problem. If you have any questions, I'll take them now.
So, Prime Minister, the amendments that you have announced that are proposed or to be put to the, well, once the Cabinet approves it and goes to Parliament, do they require opposition support, or is it a simple majority?
Well, everything we go to Parliament with, we would like opposition support. We would like to think that the opposition will support. But of course, you know that that is not what is happening. We have an opposition that has said that they will support nothing that the government does. Government brings on because they have another agenda. I don't know what they will do. But if what you're asking me is whether the government has the votes to pass it, the answer is yes. The government's majority can rectify this.
So then what happens, because you mentioned one of the aspects that is in the bill before the Joint Select Committee.
Sorry, I missed that.
Sorry. You had mentioned in terms of the number of seats, the bill before the Joint Select Committee, as you had said, referenced 15 assemblymen. Is that now taken out of that bill in terms of that amendment? What happens to that aspect of the bill?
We're not taking it out of the bill. The Joint Select Committee will continue to do its work because it has a number of meaty issues in front of it. I have seen it said that we should accelerate the work of the GST to fix this problem. That is not the government's position, because this is an immediate problem that requires urgent attention, and the Joint Select Committee work cannot be dealt with in an urgent kind of environment. It is being done, these very serious matters of amending the Constitution, Section 75, in a fundamental way. And the Parliament has given the committee an extension up to May to continue the work that it's doing, and I don't think that we'll disturb that. However, as to what number of seats we go to Parliament with, we can be guided by what the consultation had put forward, because that consultation, while not dealing with a deadlock, was dealing with the issue of numbers of seats. So we have something to use, and there's a basis for them for something. And we will go to the Parliament using that as a guide.
In terms of the allocation from the budget to Tobago and the operation of that in Tobago, given the situation.
Budget?
The budgetary allocation in terms of expenditure in Tobago during this deadlock period, is that affected or
nothing has changed, and nothing will change, and nothing can change, because Tobago's allocation is not as a result of an election here. And the accounting officer in Tobago is not affected by this election. Whoever was accounting officer the day before is still accounting officer. So any spending of government money anywhere in the THA in Tobago is still under the control of the accounting officer in Tobago. And in every department, persons who are responsible are still responsible. So there's a lot of loose talk and for political purposes and misrepresentation about who's going to thief, and that is just stupid talk. Whatever was in place to control the expenses, monies received and spent before the election remains in place today. And the day when it is fixed, as it will be fixed, those are the same things that will remain in place. There will be an accounting officer for the Tobago House of Assembly, right? And that person, that office functions, and of course they will be exposed to examination by the Auditor General and the police. So you hear these loose talk just to stir up, and they feed on the lack of information that some people have. Most people don't fully understand how the country is governed, and those who think they understand take advantage of people's ignorance and talk all kind of foolishness to incite people. Right? So your question is a very valid question, and the answer is simple. Nothing has changed and will change with respect to the spending of government money. Because you see, the political arm deals with policy. Right now, there's nobody making new policy, because the Executive Council can make policy for a short while. But then they require the Assembly chamber to institute new legislative type policies or to make certain decisions. But the accounting officer, who is not a politician, is a public servant, holding the expenditure, if you want to say the purse strings, that person is still there. The central government is still going to make money available to Tobago in the context of the national budget. And how they spend it, they will still report to the same channels that they report to, which is the Auditor General. Right? So this political deadlock, which will inconvenience us for a while with respect to the functioning of the Tobago Parliament, that is what the problem is, and we're going to solve it by putting an authority to break the deadlock.
I have a question, Mr. Prime Minister. This legislation, like the amendments to the THA Act, it could possibly be done in two stages. One might be to immediately help them resolve the immediate deadlock now, and then the second thing could be the whole electoral boundaries, because that might take some...
No. The two things are related. Because if you were to break the deadlock, you have to interfere with the boundaries, because you're going to interfere with the seats. They have 12 seats. They have boundaries. The man in the street knows that if we go back to the polls, we shouldn't go back with 12 seats, because we could do the same thing again. And we're saying we shouldn't do that. We should change the number to virtually prevent that from happening. Once you change the number, you will have some change on the boundaries. Right?
My question would have been, for example, if you're in the first stage to break the deadlock, to legislate that you allow for straws to be drawn or for a coin to be flipped, or even for them to get creative and say, well, the first 2 years maybe one party does, and then you break the term into two, but some immediate thing to satisfy.
That leaves us with a certain component of arbitrariness, which I see no appetite for, and I've heard no appetite for. And to go and legislate to draw straws, and legislate to flip a coin, well, let's go one further and not have any elections at all, and just toss a coin. and whoever call heads correctly be the government. That is the logical conclusion of that. It is too important a decision to leave it to the tossing of a coin or the drawing of a straw. The population is best positioned to solve this matter, and that's why I have listened very carefully. I've listened with much of an open mind, and the general sentiment that I have heard is that the situation requires a going back to the polls.
In terms of the bill, the number 15, in terms of assemblyman.
That's just an option. Because I have not seen a proposal from the AG yet. The idea, I've spoken to two ideas here, right? One is to give an authority to break a lock and call an election, and the other one is an authority to change the number of seats so that when you go to the polls, that number of seats will be the tool to break the deadlock.
I was just wondering, in terms of the bill, the number 15, that is in the bill before the JSC. How did you
it's a proposal, yes, and the proposal.
That number?
How what?
How did you put the government?
It wasn't the government. It was the Tobago population. There was a 2-year period where there was widespread consultation in Tobago for a whole suite of changes that should be made to the governance of Tobago. One of them was this whole question of how many seats should be in the assembly. Right? And that forms part of the basket of proposals. So I'm saying that is now only a guide. We'll be guided by that. Right? Because it came about as a result of work that was done in Tobago, consultation that was done in Tobago, so we don't have to reinvent the wheel on that score. Okay?
One question on another matter, if you don't mind, Prime Minister, very quickly.
Correct, sure.
The UNC had a round table on the issue of the procurement amendments. Former minister was part of a previous PNM administration, was part of the round table. The opposition is trying to gather support for the repeal of those amendments. Any response?
No, my response is the government's position is very well known. It is being consistently misrepresented. The opposition has to find some issue to make itself relevant, and by their style, to confuse the population. If they choose that, that is their business. I will just be convinced further that birds of a feather flock together. Right? That's all I will say to that.
Also, the Venezuelan migrant card registration system, could we get like an update, please?
Minister, you are ambushed.
Yeah.
Thank you very much, Prime Minister, members of the media. Yes, I saw some reference to a Newsday article on that. I believe it might be today. The Cabinet, last week Thursday, approved and confirmed the process for us to proceed, to have exactly what we described, both the Prime Minister and myself, which is we're going to go back out. The Venezuelans who already registered are going to be asked to fill out forms and to not re-register, but to provide up-to-date information, and we're going to give out new cards. It's not going to be similar to the previous situation, of course, because we're in COVID. So what we're going to do is develop a drop box system and a proper system, which I have immigration working out now. And I've told them they must do that very, very quickly, because I want to announce how we're going to proceed, and it'll be for 6 months in the first instance, with again the option to go for a full year. So no new registration, no one who was not previously registered can register in this process. It is a re-registration and updating of information, and at the end of that we will give out new cards for those persons. There have been a number of who have dropped off. I have signed a number of orders within the last few weeks of persons who no longer want to be registered in the process, as amazing as that might sound, and they've gone on to other pastures outside of Trinidad and Tobago. So it will provide us with up-to-date figures and up-to-date information of those who want to re-register, who already registered.
I mean, there are actually, I've spoken to one or two who were not even able to get their card from the very first registration.
Well, I saw that's what the article was suggesting, yes.
Right.
So, I mean, again, I don't know what those particular circumstances were. I continue to monitor it. All of the cards for the persons who were registered were produced by immigration. Maybe those persons didn't go in when they were supposed to go in. I am not involved in the administrative distribution of the cards. All right, but those cards are now redundant anyway.
Okay, no, I mean, I had the experience of going to help somebody and you're turning up there and then actually, it was about 6 months ago, you're actually being told that these cards are not available, that basically they're saying anything because of the COVID, they're telling people anything to get rid of you.
All of those things have to be worked out with the proper protocols, etc., to fulfill what I've just described. Okay?
Is it kind of adding a cumbersomeness? So, because what I'm saying is, if there are people who did not get it properly the first time, is it adding
I don't think it's adding anything, Mr. Douglas. I think what it does now is provide the opportunity for those who were registered, who may not have received their cards, but were properly registered, because we have those original records. They can now fill out their updated forms, and they will get their new cards. Okay?
Are you expecting anything from it, like in any sort, like the reason?
I'm expecting the up-to-date information, and I'm expecting persons to get their cards and for us to just get it done. Okay? Thanks a lot. Thank you, Brian.
It's a sensitive investigation and a sensitive search. Well, a sensitive investigation and search for Andrea Barrett. But any comments on the issue regarding that?
No, I have no additional information other than what is already in the public domain. And of course, you would have seen the commissioner saying that it is a sensitive investigation and there are certain things that should not be spoken about at this time, since it may assist the perpetrators. All efforts are being made to find this young lady. It's yet another instance of the criminal element terrorizing the country, because the whole country is traumatized, and there's a young lady somewhere. We hope that she's not harmed, and every effort is being made to follow all the leads. The Commissioner of Police is leading it himself, the Defense Force personnel and others, and the private sector specialists. We are all out there, and we're just hoping that the end result is one where she can be returned unharmed. But when these things happen, as they happen from time to time, we are limited in what we can do, but everything that we can do. And the one thing I want to say on that is that when these things happen, there are people among us in the population who know what happened. And all I could say is that to whoever is listening, if you know something about this young lady and what is happening to her, just remember that the upholder is worse than the thief. If you know something, you can safely say something to the authorities to assist us in recovering her. In these crimes and similar crimes and crimes in general, there's usually or most always somebody who knows something that is useful to the investigation and the search. Please, if you are that person, come forward or get the information to law enforcement or somebody who will get it to law enforcement, so that the search can be focused and have a better chance of being successful. But I refuse to believe, from what I've seen, that there are people who do not know what has happened to this young lady.
Almost renew this call for pepper spray. I know Mr. Young said yesterday that he's got a report from experts. Can you say where the government is on that?
As soon as the matter comes to the cabinet, we will deal with it, and we will take a decision and we will proceed. Nothing is cast in stone. Opinions were expressed, facts have been sought, and we will be guided by that, and we are open to being guided by the facts. And if it is something that we can get involved in, and if it doesn't work, we can always do something about it. But we are prepared to use every single tool in the toolkit to protect the population, especially the vulnerable or the most vulnerable. So we're not ideologically opposed to anything. I am anxious to hear what the report says that the minister has, and I expect that he will bring it to the next National Security Council meeting, which would be next week, and we will have a decision soon after that. Okay? Thank you all very much.